Welcome to today's talk session. My name is Deidre Moss, and I'm the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. In recognition of Glaucoma Awareness Week, which is observed March 6th through the 12th this year, we've invited the Bahamas. Let me see if I can get this word right. The Bahamas. I will let you guys. I don't want to mess with this word. But we've invited this group to help us dissect this topic. So at this time, I will pass the virtual mic to our guests so that they can introduce themselves. So we start with you, Nurse Gordon.
Good afternoon, everyone. My name is Italia Gordon. I'm the president of the Bahamas Society of Ophthalmic Nurses.
Good afternoon, everyone. I'm Dr. Duranda Ash from Ash Eye Institute.
Good afternoon. My name is Dr. Salvador Tenio. I'm an ophthalmologist, senior register at Princess Margaret Hospital.
Good afternoon, everyone. My name is Keitha Meadows, and I'm the vice president of the Bahamas Society of Ophthalmic Nurses and an eye nurse specialist deployed at Princess Margaret Hospital.
Thank you so much to our guests today. We're so excited to have you on to help us talk about this topic today. But before we begin, if you just join us, please share, like, view, and subscribe to our YouTube channel. And if you enjoy this content, we want to continue talking about those topics that matter to our community. And so as we move forward, can you tell us about the Bahamas Society of Ophthalmic Nurses? I got that right?
Ophthalmic.
I know I messed that up somehow. And what is the purpose of this organization and which community does it serve? We start with you, Nurse Gordon, and then we'll go around.
Okay. So basically, the Bahamas Society of Ophthalmic Nurses comprises of a group of ophthalmic specialist nurses and allied health professionals. Our common goal is to reach out to the community at large in regards to bringing awareness for eye health, also to promote the awareness as it relates to preventable blindness, because there are a lot of persons in the community, they're not aware of how important their eyes are and why they need to have an eye exam done. And so what we would do is we would actually liaison with other private NGOs, private civic organizations in regards to assisting persons that may not necessarily be able to come to the clinics or may just not know how important it is to get their eye screened. And so we would actually plan community initiatives to go out to them through free eye screenings, and the ones that need to be referred, we refer them to the regular clinics, such as where Dr. Tenio works at the Eye Care Center, or if they can't afford it, we will refer them to any of the optometrists or ophthalmologists that they are able to attend. And so it's just an organization, nonprofit, like I said, where we share our gift, which was the ophthalmic specialist group that not graduated, but completed their program in 2019 as a give back. So we want to give back to the community in a way that God has blessed us with a gift, and we want to just share it so that others can actually benefit from it.
Thank you so much. We'll come to you, Dr. Tenio.
Yes, okay. I'm an ophthalmologist in Princess Margaret Hospital, and mainly we see public patients. We see patients at our Soldier Road Clinic and the Eye Care Center. And if we need to do any procedures or anything, we do those procedures at Princess Margaret Hospital. So basically, we see public patients, and we do regular checkups, of course, including glaucoma and other eye diseases. Okay.
Thank you, Dr. Ash.
Well, I want to start off by saying that I'm really, really overjoyed that we have a Bahamas Ophthalmic Nurses Association. As I'm sure many are aware of, glaucoma is extremely prevalent in the Bahamas, and there is a very finite amount of ophthalmologists like myself and Dr. Tenio, and so the fact that we have specifically specially trained ophthalmic nurses who can really get out and who are getting out into the community to do the mass screening that's really necessary. Glaucoma is a preventable cause of blindness. So if we can pick it up early, treat it aggressively, that individual need not go blind. So I'm just overjoyed that the Bahamas Ophthalmic Nurses Association exists, and that they're doing the great outreach in the community that they are doing to make people aware of glaucoma, aware of whether or not they have this disease, aware of the importance of eye health.
Yes.
Thank you.
Thank you. Thank you, Dr. Ash. Nurse Meadows.
Good afternoon again. Yes, I find myself in a unique position being a part of the Bahamas Society of Ophthalmic Nurses because we have that opportunity, as was mentioned, to get out there and mingle with the community to let them know, look, we got your back. We're here for you. You might not understand all the fancy terms and stuff that's going on, but the bottom line is we don't want you to go blind. Here's how to do it. And we're here to do free screening at times in various areas, sometimes even in the family islands, so that persons would know that this exists. It's the thief of sight, and you want to preserve your vision. Apart from that, I also work in the eye theater, so I get to see both ends of it, where you can screen persons who have glaucoma or who might need assistance. And then the other end, if they have to come to the clinic or to the hospital, where you're able to walk them through that process of being able to get that procedure done.
Thank you. Thank you for mentioning that, Nurse Meadows, that you are, reaching out to the community as well to share this information. So thank you for sharing that. And so we move on. We move on to our next question. Again, I want to thank you all for being here, taking time out of your schedule to talk about this very important topic. And so we want to look at awareness. Dr. Ash, you mentioned that glaucoma is prevalent. It's prevalent in our country. So what is glaucoma for persons who may not really fully understand, what it is, and why is it important to raise awareness about glaucoma? So I'll start with you, Dr. Tinio, and then move around the group.
Okay. Glaucoma is basically an eye disease wherein the nerve of the eye is getting damaged. We're not exactly sure still what's the exact cause of glaucoma, but we know the eye pressure inside the eye is a very significant cause of the damage that is happening to the nerve at the back part of the eye. And for us, let's say for my practice, the patients I see every day, it's very, very prevalent. Maybe let's say something like 80% of the patients I see every day has some form of glaucoma. And there's a lot of people that has this, especially in our community, and statistics is saying 50% of the patients that has glaucoma don't even know that they have glaucoma, and they haven't gotten a checkup yet.
Thank you. We come to you, Dr. Ash.
Yes, as Dr. Tinio said, glaucoma is a disease of the optic nerve. The optic nerve is that part of the brain that's responsible for our vision. The really unfortunate thing about glaucoma is that there's no pain. There's no pain. There's no eye pain. There's no burning. There's no redness. Many of us respond to pain. We respond to a discomfort. And so what's happening is that many people, when they go present for burning eyes, some sort of eye problem, when they go and present for glasses, to someone like myself, who's a medical doctor specializing in diseases and surgery of the eye, and like Dr. Tinio, then they find out that, hey, you have glaucoma. And so it's so important that persons are having just routine annual eye exams. You know, when I think one of the big problems is that we just think in terms of our eyes with reference to glasses. You know, that the percentage of people not knowing that they have glaucoma is so high because so many people are going to the pharmacy and buying those over-the-counter reading glasses. So they're never really having their eyes tested by an ophthalmologist to find out that, hey, here's a problem that needs to be addressed. Here's a vision threatening, like Nurse Meadows said. Glaucoma is the silent sneak thief of sight, meaning that the only way you're gonna know whether or not you have it or that be a suspect is by a vision outreach screening that our nurses are doing, or having your eyes actually examined by an ophthalmologist. So that's one of the big issues with glaucoma.
Thank you, Dr. Ash. We come to you, Nurse Gordon.
Yes, ma'am.
Nurse Gordon.
Yes, ma'am.
Yeah. Why is it important to raise awareness about glaucoma, particularly in the Bahamas?
In the Bahamas, well, first and foremost, we are predominantly a Black nation. And one of the predisposing factors for glaucoma is ethnicity, because you're a Black person. For some reason, most of these diseases are related to our ethnicity, which we are predominantly Black. So with the type of glaucoma that we are commonly hearing about or seeing, with the open angle glaucoma, Black persons are exposed to it more than white persons for some reason. And as it relates to the closed angle glaucoma, the Asian persons are more exposed for it. So as it relates to bringing awareness, we definitely know a lot of persons don't like to go to the doctor on the whole. And so if we can present this platform to as many persons as possible, at least they will understand that it is the silent thief of sight, and they will understand why it's so important that if you don't get your eyes checked, it could actually cause blindness. And so for that reason, we would want to bring more persons, especially the younger population, who are not aware that it's hereditary. And as young as children that are born, they have what they call congenital glaucoma. And so therefore, we have to bring this platform to every person, no matter what age, because if it doesn't happen to you, it could be a grandparent, it could be a mother, and because it's hereditary, you need to stress the importance of why getting their eyes examined at an early age, sometimes because of the family history, to these younger persons who don't think that eye health is important, as well as to the older population.
Thank you for sharing that. And as you would have mentioned, Dr. Ash, you mentioned that there's not a lot of doctors who specialize in eye care in the country. So just sharing this information. Thank you, just for sharing this information. You talk about sometimes we experience an issue with our eye, or we're not able to, we may be experiencing an issue and we think that we could just go over the counter and purchase, glasses over the counter, but it's so very important to get tested and really try to figure out, what's really going on with the eye. And so because, like Nurse Gordon would have mentioned, you do have situations that can occur that can maybe lead to blindness. So getting these tests done is very, very, very necessary and very important. And so I want to jump to Nurse Meadows, looking at the level of satisfaction. And I'm going to go around to each person. But considering the level of satisfaction, are you satisfied with awareness as it pertains to persons really being aware of glaucoma and the issues that are associated with it, vision and eye care and all that stuff. Nurse Meadows, are you satisfied?
I am not fully satisfied with awareness as yet, but I must say that we are getting there. We are doing our part, especially as a society, to make persons aware of it, because like was mentioned before, persons don't even remember they have eyes until they feel something in it, probably like a grain of sand or something may have blown in it, and then they begin to rub their eyes or something. So it's almost like they're not even conscious that they need to check their eyes just as well as every other part of their body. In terms of getting that awareness out there, we still have much ground to cover. So no, I am not fully satisfied with awareness with glaucoma, because if you ask persons, some persons would be able to tell you what it is, and maybe perhaps because their grandmother or some relative may have had it, or they may have heard the term, but in terms of fully grasping the seriousness of this disease of the eye, no, a lot of persons still need to be educated about it.
Thank you, Nurse Meadows. Dr. Tinio?
Right now, we still need a lot of help in disseminating this information. With the help of the nurses, just like Dr. Ash said, we're very happy with the ophthalmology nurses helping us with disseminating this information and your show like this, because sometimes it's sad for us to see patients coming in when the problem is in the end stage already, or if the damage has been done a lot already inside the eye. So the earlier that the patients could go for an eye checkup, it's better for us and the patients as well. But we need a lot of help still in disseminating this information about glaucoma.
Thank you, Dr. Tinio. Dr. Ash?
I've been around for a while now, and when I look back at, how things were compared to how they are now, we have come away with reference to my patients. I'm hearing that they're knowledgeable about, my mother or my grandmother had glaucoma, or my grandmother or mother went blind. But still, as Dr. Tinio said, there's still so much more to do. So there is so much more to do, and it's really, really so great, as I've mentioned before, and I'll mention it again, to have such a society, to have such an association as the Bahamas Ophthalmic Nurses Society. So yes, this is great. And as much events, as much outreaches, knowledge is power. And, it's a preventative cause of blindness, meaning that if it's picked up early, if it's treated aggressively, you do not go blind. Now, as Dr. Tinio alerted to, the unfortunate thing about it is if you come in and you've already lost vision, we cannot. Man has no surgery. We have no technology to bring back whatever vision is lost. And so that's why early detection today, the technology that exists to diagnose glaucoma, we could pick it up 7 years before you could see it with the human eyes. To manage glaucoma, it's amazing. It's amazing what exists today. But the key is, you have to come in. You have to come in early, and you have to be on it for us to prevent blindness.
Thank you so much, Dr. Ash. You talk about coming in early, trying to catch it, and that's so very important that you mentioned that you do have the equipment that you can capture this information in advance. And the unfortunate thing that you did mention is if you lose some parts of your vision, you can't get that back. So that's why it's so very important to come in early and get your tests done. So come to you, Nurse Gordon, what is your view on the level of satisfaction? Are you satisfied? Are you satisfied with glaucoma awareness in the country? You mentioned, you talk about a lot. You talk about glaucoma within certain communities. And so are you satisfied?
No, ma'am, we're not as close as we need to be as yet. Working at the clinics, which is preventative care, we have persons coming in, being referred, and the sad thing is we don't know what happens or who follows up afterwards because we only can give them the referrals, educate them, and let them know the importance of going to the ophthalmologist to get screened. But after that, we're not sure if they were actually being followed up or if they were following the advice that we would have given them unless we were to call. And it's so many persons that you may not catch a few of them at a time. But as it relates to bringing the awareness in the community, I am thinking that with the initiatives that the society will be presenting as we go through this year, that more persons will be encouraged to see their ophthalmologists or optometrists, and hopefully we will get there one day.
Yes, I certainly hope we do. So I just want to go to our viewers and those persons who may be listening in. I want to thank you for joining us. And also doctors, nurses, are they able to ask questions if they have any? Are you guys open to taking questions?
By all means.
Okay, so persons listening in, I see you guys viewing. If you have any questions, put your questions in the comment section. I'll go to the comment section and get your questions in, okay? Thank you guys for viewing. And so that brings us to our next question as it pertains to initiatives. We know about your association. And can you give us the name again? Because I stumbled on that name. I don't want.
Bahamas Society of Ophthalmic Nurses.
Bahamas Society of Ophthalmic Nurses.
Or you
I
can
got it
say
right?
I nurses. That's what I want.
No, but I said the word. No. Don't take that away from me. Did I say the word right?
Say it again.
Bahamas Association of Ophthalmic Nurses.
No, Bahamas Society of Ophthalmic Nurses.
Okay, I'll say the I. Bahamas Association of Eye Nurses. That's fine.
That's fine.
Okay, so I want to talk about your initiatives. As it pertains to your association. What are you doing to help, spread awareness of glaucoma awareness, as this is Glaucoma Awareness Week? Nurse Gordon, I'll start with you and I'll go around to everyone else.
Well, I will first start off by saying that we had collaborated with the Glaucoma Awareness Committee, which is a committee that formulated from the Public Hospital Authority, group of nurses and doctors. Dr. Rana Green is the head ophthalmologist in regards to the Glaucoma Committee, and the chairperson is Nurse Marcia Swift. And we had collaborated with the talk shows in which I was present for, well, 2 of them so far. The other awareness platform that would have been slated was a poster competition that was done throughout the schools, where the children were actually educated on doing posters, in which they had a poster competition where they had to draw and give their idea of what the theme meant, which is the world is bright, save your sight. And so Kingsley Academy got the top prize, as well as the Catherine School. Also, we had persons in the mall. They had displayed a mall presentation, bringing information about glaucoma, giving pamphlets out, and they had a few of the nurses there to, I guess, facilitate any questions that the public would have who would come at the mall presentation. And so that was another way of them helping with disseminating the information as it relates to Glaucoma Week. I was on a show yesterday, like I said, with Mr. Spencer Emerson and Dr. Dean, in which the audience was very well engaged. We also had, I think they had breakfast given out to the patients at the eye care center, in which they also disseminated information while they were there and giving information regarding glaucoma. And the other thing I remember was basically the church service in which we commemorated that was Sunday at Bethel Baptist Church. And so those members and those viewing persons via Facebook and Zoom were able to get some of the information also when we was there. So that was the major activities that I recall we had with the collaboration of the Glaucoma Awareness Committee.
Thank you for sharing. You have been busy. You've been busy. Nurse Meadows, are you your initiatives?
Yes, as well as Madam President Gordon just mentioned, we were involved with the committee for the glaucoma, and I was also a part of getting to the schools with the poster competition for the children to make sure that they're involved, because glaucoma, like we mentioned before, is not just an adult problem, it's everybody's problem. As well as she mentioned the mall at Marathon in terms of having the display there. Also at Princess Margaret on I Ward, there was a display there so that persons would see some of the things affecting the eyes in terms of glaucoma. And it would start the conversation as to what do I need to do, or when would I need to be involved with this, or what about my Grammy, or whatever it is. And once it started the conversation, we were able to let persons know, yes, this is a disease of the eye and you need to save your vision. In other terms of initiatives, there was other things that we would have done in terms, I remember, of the Honkathon, where there were posters on cars and it said messages about vision, about saving your sight, and why it's so precious and why you should preserve your vision. So we are out there doing some things. There, like we said, there's much more ground to be covered, but we are in this together.
Sorry,
Thank you. Go ahead, go ahead.
I almost forgot. We had a courtesy call at the Ministry of Health where we was able to share the information to the permanent secretary for the Ministry of Health and Wellness, also the director of nursing. She was alerted, and so the information got out somewhat on that level. So we were able to present them with ribbons, which represented the Glaucoma Awareness Week with green ribbons. Miss Meadows would have hers on. I'm sorry, I don't have mine on. But yeah, it started a story because it actually has an eye on it. It was actually designed by one of our ophthalmic nurses, Nurse Donaldson, our past immediate president. And it starts the story once they see a ribbon with an eye on it. They're trying to figure out why is this eye on this ribbon. And so that gets the story started, and we are able to explain to them what the green represents, what's the importance with it as it relates to the eye. And the Bahamas flag was on it. So we are letting them know about the prevalency of it in the Bahamas also.
Thank you. Thank you so much for sharing those initiatives. Dr. Tinio or Dr. Ash, would you like to add anything to that?
Okay. You could go ahead, Dr. Ash.
Huh? What's that?
Okay. Oh, you could go ahead.
Okay. One thing that I think is very important, and this is just something that's ongoing. It's not unique to this special awareness period. Every patient, especially if you have a glaucoma patient, is very important to find out if they have made their children aware, because as we would have mentioned, it's genetic, it's hereditary. If you have a family member with it, if a parent has it, chances are they can pass it to their children. You know, if you have or they can pass it to their siblings, or their siblings probably have it. So just making them aware of the importance of letting, their family members know that, hey, I was diagnosed with glaucoma. It's very important for you to go and be checked as well to make sure that you don't have glaucoma. Because a lot of times, someone will say, well, my mother or my dad didn't say anything. And, my response is, how many people have high blood pressure in your family? And they don't come and say, oh, I have high blood pressure. But if you start talking, then they'll say, oh yeah, I have that too. And I take this for it. So it's so important you have to be real directed. And so that's something that I do. That's something that I've been doing, because, we got to get this word out. We have to get the awareness out 24/7.
Okay. For us, the glaucoma, every year we try to celebrate the World Glaucoma Week, and also thanks to our department head right now, Dr. Green, which spearheads the information drive also. Basically, every year we try to do this information dissemination, and we were able this week also, we were able to do some continuing medical education for the nurses, the healthcare workers, so that they could help us disseminate this information. And the more people that's spreading the news or the information like this, the better for us. Okay.
Thank you. Thank you all. Thank you all for sharing those initiatives. Thank you so much. And so I just want to jump to questions in the comments. Ms. Roll is asking, what are some of the preventative measures that one can take? I guess she maybe is referring to eye care, but what is some of the preventative measures one can take? And also, can your diet be the cause of glaucoma? I guess anyone can take the question.
Okay, I think the most important thing is to get an eye checkup. There's no exact relation to the diet that anyone could take, that anyone could get glaucoma, but there's a lot of different things, like the age of the patient, the other problems of the patient, like high blood pressure, diabetes, those things, especially if the patient has a family member with glaucoma. It's good to have an eye checkup. That's the only way that we'll know that if the patient has glaucoma.
Thank you so much, Dr. Ash. Would you like to add to that, preventative measures, or is there something in the diet?
Preventative measures. One thing that's important, say for instance, you went in and you got checked. Things could change from year to year. So it's very important, if there's a family history, if there's a concern, that you are being checked annually. As I think Nurse Godden, I believe, or one of the nurses alluded to, the eye is a part of the body. And so a healthy body helps and gives rise to a healthy eye. So it's so important to just eat well, to have a healthy lifestyle, and that will help your eye health as well.
Thank you so much, Dr. Ash. So that brings us to our next question. What we want to get to our trivia for those persons who is listening. So I'll put it in. You can put your answer in the comment. When is Glaucoma Awareness Week? And also list one of the initiatives that nurses and doctors would have talked about. So while we do that, I wanted to go to each of you and ask you, as we wind down, are there any additional comments that you would like to add? Patrick is asking, is there any discomfort with glaucoma check?
Okay. It's good for us to do a complete eye examination with some dilations for the eye. What we would do, we would check the patients in the eye clinic. We would do testing for the vision, and later on we would put some medications on the eye to dilate the eye for us to be better view the nerve at the back part of the eye. It may cause a little discomfort. It might cause some patients say it's getting a little too bright, but it's usually just temporary. It usually just lasts maybe for something like 6 to 8 hours after the treatment, maybe a little bit longer than that. But besides that, there's no pain. Okay.
Thank you, Dr. Tinio, for answering that question. And so I wanted to ask you, as we wind down, are there any additional comments you would like to add? Nurse Gordon, we'll start with you first.
I would just like to advise the viewing public on this platform to please don't take it slight or lightly that glaucoma is the thief of sight. It is the silent thief of sight. And with that being said, the only way you would know if you have it is to visit your optometrist or ophthalmologist on a yearly basis if you know you have a family history of it. Or if you are over the age of 40, definitely you should have your eyes screened at least once a year.
Thank you, Dr. Tinio.
I would just advise everybody to have an eye checkup, especially those people with a relative that has glaucoma, so that they could be assessed. If, just like what I tell my patients, have their family members check, especially those patients with glaucoma, have their family members check. If the family members doesn't have it, then thank God. But if we find that the patient has glaucoma, if they have glaucoma, it's best that we see it early so we could save the vision. We could preserve it as much as we can so that the patient could enjoy it the rest of their lives.
Thank you, Dr. Tinio. Dr. Ash?
I'm gonna echo Dr. Tinio. You know, we mentioned how prevalent glaucoma is in the Bahamas. And one of the reasons for that is a lot of times you'll have a person that both of their parents have glaucoma, or it's on both sides of the family. You know, today I saw a mother and her daughter, and both of them were legally blind from glaucoma. So, you know, I have another mother and her son, who's a well-known artist, legally blind. So this is, and you know, the Bahamas is, you know, it's we live in a beautiful country. And so our vision, to be able to see, to have the gift of sight is so important. And glaucoma is preventable. Loss of vision is preventable. So, you know, as Nurse Gordon said, it's so important to, once you hit 40, and even here in the Bahamas, sooner than that, I've seen glaucoma as early as 20. So it's so important to have an annual eye exam. You know, prevention is better than cure. We don't have a cure.
Dr. Ash, what are the signs? Like, okay, you talk about going in to get the eye exam, but what are the signs? What should really prompt you to say, okay, I need to go and get my eyes tested, or just, you know, just because of your age, should you just go in? What are the signs?
That's the problem with glaucoma. There are no signs. There's nothing that, it's the silent sneak thief of sight. If you're waiting for a sign, the sign could be that you can't see. And you know, and then you get there and you want somebody to give you a pair of glasses, and glasses can't help. Yeah.
So you're saying just anybody,
yeah,
they should get their eyes checked annually.
Yeah. Or any vision screening that, our great nurses are having, get there, get out, be a part of it. And if they encourage you to have further testing, go and do the further testing. It's so, so important.
Wow. That's so important that you mentioned there are, because I'm thinking maybe something would happen that would prompt you to go and get an eye screening, but you're saying basically there really isn't any sign.
It's the silent sneak thief of sight.
Yeah.
Silent, sneak, thief.
Wow.
Yeah.
Go ahead,
So-
Dr. Tinio.
So just I'm adding on to that. Patients when patient could be 20/20 in the sense, if they look straight, they could see 20/20 perfect vision. There's no eye redness. There's no eye pain. Most of the time, there's no eye redness and there's no eye pain. Because the problem is it's the periphery. It starts in the periphery. As it progresses, it goes down until it's only a tunnel vision that's left. And sometimes that's when the patients would notice it. The patient would cover one eye. How come I could only see right there in the center? That's some of the patients that walk into the clinic complaining of how come they only when they cover one eye, they could only see a tunnel vision. That the periphery is gone. But even if you look at the patient still sees 20/20 right there in the very center. So that's the problem. So when they come in, when patients usually come in for glaucoma, it's advanced. There's significant damage already. So have even though you feel okay still, have an eye checkup.
And it's at that time you can't really do much
We can't bring it
at
back.
that advance.
Yeah.
Irreversible.
Yeah.
Wow.
We could try to preserve what's left, but those areas that are damaged already, nobody could bring that back.
Oh wow. No surgery, no.
No.
Wow.
And it's not just here, it's around the world. It's even if they go to the States, the specialists in the States, nobody can bring that back. What everybody could do, what the doctors could do, is try to preserve what's left. That's the most we could do, and do our best to maintain it. Okay. Yeah.
Wow. So that reminds us that vision health is so very important. And can we go back, Dr. Ash, about those recommendations as it pertains to getting your eye tested? You said you talked about once you reach 40, but you go in a little bit down to even at the age of 20. So can you talk about recommendations for eye testing and eye screening?
Well, the literature says 40, but in the Bahamas, because it's so prevalent, I have seen, and I've been around for a while, I have seen as early as 20. I had a 12-year-old today, and his optic nerves were very large. And, he was 12, very large optic nerves. So there's a test that we do to diagnose glaucoma. It's called optical coherence tomography. It's like doing a CAT scan or an MRI of the optic nerve, and it goes beneath the surface. Now, that's not really done on anyone until they're 18 or older. But I did that test on him because I wanted his parents to have documentation of the size of his optic nerves. He didn't have glaucoma, but they were very large because I didn't at that time, I did not know his family history. So I wanted his parents to have a copy of that because I'm sure later on when he goes to another eye doctor, once you look at his optic nerves, you will believe that he has glaucoma. Now, his dad was in another room. When I examined his dad, there was a concern about his dad, his 40-something-year-old dad having glaucoma. And then his dad told me that his mother had glaucoma. So I just share this to say that the literature says 40. When I have But when it's in the family, I'm asking, you know, in fact, I've seen 18. I've seen 18 before with glaucoma. So it is individualized. Glaucoma is individualized. And even when it comes to, you know, when you should start being checked based on what's happening in your particular family. So, you know, even if you have a family history of glaucoma, even if you go in, you're tested, you don't have it, it's important to check every year. You could be good this year, but something can happen within a year's time. So it's important to be checked definitely annually and or however advised by your eye doctor.
Well, thank you. Thank you for sharing that, Dr. Tinio and Dr. Ash. Marcia, thank you for joining us. She's saying visiting your eye doctor is very important because sometimes you may have glaucoma and don't know. Wow. I want to get back to those comments. And Patrick's saying, start early, start from the school level. Dr. Ash, she's saying start early in terms of eye screening. Let me get to his comment. He said, teach the children in school to teach parents to go get checked.
Actually, you know, I wanted to comment on that. That's what Nurse Gordon is and the nurses are doing. They are in the high schools educating them, educating the children so that they can in turn educate their parents. That is a good thing. We have done screenings in the past. I have done screenings in the school, but it was more for, you know, vision, the need for glasses. But the nurses are on it. You know, they're on it. They are in the schools. They are educating the kids. And yes, that's what we ought to be doing. And that's what our nurses are doing.
Thank you so much. I'm going to come to you, Nurse Meadows and Nurse Gordon. Nurse Gordon, some persons would have answered questions in the chat. So can you tell us, because we do have some giveaways today. Can you tell us about our giveaways before we get back to our comments?
Okay. There is a certificate for a $50 coupon to Dr. Ash at the Eye Institute. And we also have a comprehensive eye exam donated by Dr. Rana Green and Dr. Anita Dean.
Okay,
so that's a full comprehensive eye exam. So please take advantage of it.
Awesome. So that is a full comprehensive eye exam. Patrick, I think, are you clapping? Ivy, Patrick, are you clapping or are you raising your hand? And so that is our giveaway for today. Just that giveaway, right? Or we have another giveaway?
That's three of them. That's Dr.
Oh, three.
Dr. Rana Green from the Green Eye Institute. And there's one from MJB Optical from Dr. Anita Dean. And we also have by yours truly, Dr. Ash, a $50 gift certificate at her Eye Institute, Ash Institute. So
thank you so much. Thank you, Dr. Ash, and thank you to all of those who would have donated. Those eye screenings are very important. Sabrina saying when patients are placed on glaucoma drops, this is usually for life. They need to be made aware of this. Is this true?
Yes.
Wow.
Yes, it is.
When we start with glaucoma medications, yes, we tell the patients we need to continue those medications unless we do some adjustments, if we do some changes. But usually we try to see our patients as, you know, as much as we can regularly, so that we could monitor the pressures because those glaucoma medications try to lower the pressure inside the eye. So we try to see them, and if ever, you know, there's instructions later on to adjust it, then we go from there. But don't change it unless we see we do the suggested.
Okay. Thank you so much, Dr. Tinio. Nurse Gordon, Nurse Meadows, do you have any additional comments you would like to add? as we wind down. Before you do, I just want to mention, Marcy, I see you. I think you were the first to comment, and Ms. Rowe, you were the second. So we're going to get back to you for those giveaways. But you can jump in, Nurse Meadows, and then we'll come to you, Nurse Gordon.
Yes, as was mentioned, you were asking about signs that persons would probably know that they have glaucoma, and actually, like as was mentioned, there are none, not in the early stage until things get really bad. And what happens in the early stages is people tend to brush it on the side. Oh, well, you know, maybe it's just this or maybe it's just that. And it can be that that peripheral vision is being depleted. Now, in terms of the awareness for the children and their parents, we try to do that. And even working at the hospital, I encourage relatives who probably come in with their family members with their glaucoma drops, or they might have questions about their glaucoma drops. I would say to them as well, this is how you need to instill it. Always put it in, do not stop it until the doctor tells you to, or if you need to change something, someone has some allergies or whatever, please inform the doctor, get back to us. Then the other thing I usually say is, we are here for you. If you have any questions on this, we're here to answer your questions. We know that it's not as simple as it may sound, or it might not seem as important. So we're here to inform you that this is very important. And they want to know how important it is. I'm like, close your eyes and walk forward. And they're like, if I close my eyes, I cannot see. I say, there you go. If you do not check this, you will go blind.
Thank you. Good point. Nurse Gordon?
Piggybacking of what Vice President Meadows was alluding to, medication, patient education. We can't stress this enough. And as nurses, patient education is the #1 priority as relates to allowing the person to know the importance of why their medication is so important. I've heard persons come in and say they cannot afford to buy the drugs. I understand in a financial issue, you cannot afford it, but you have other outlets and other sources, social services, getting a med card. I'm thinking some of the drops are on the formulary for NHI, but you only can advise them and just stress the importance of compliance, medication compliance, because like Dr. Tinio said, the drops are very important. That's the only way they would know if the drops are working. And so patient education, I cannot stress it enough, is something that we have to continue as it relates to just encouraging them to take their drops and to reach out to persons, because like I said, the drops are expensive. I've heard even a nurse just last night tell me how she had to pay like $60 for just one box for her husband. And I'm like, I know it's important to get it from the pharmacy, but when the pharmacy doesn't have it, you know he needs this every day. So please try your best to get it for him. And she was just like, you know, financially, it's, you know, it's a strain sometimes. So we only can educate them, stress the importance of it, and pray that they will reach out to social services and other outlets. Hopefully, BSTORM will soon start writing some checks so we can help some people. And NHI, I'm hoping that more of the drugs would be included to help facilitate for persons who cannot afford these drugs.
Thank you. Thank you so much for adding that, those comments. And so I want to go to anyone here. I want to thank all of those persons who are here on this platform with us, who are silently participating. Thank you so much, all of you, Ms. Newbold, Ms. Swift, Ms. Audrey, Sabrina, Nurse Meadows, Ivy, Patrick, thank you so much for being a part of this session today. Dr. Ash, Dr. Tinio, Nurse Gordon, thank you so much. And I would just like to open it up if you would like to add anything or share anything else as it pertains to any pages or anything you have you would like to share. I'm not going to call that the society, I'm not going to do that, the Society of Eye Nurses. I'm not going to use that word. But if there's anything else you would like to share before we close out our session today.
Good afternoon. I would just like to encourage everyone to Let your family members know that there is an exhibition in the Mall of Marathon with the posters that the school age children did. Kingsway Academy, they had like 17 students who participated in the poster competition, and Catherine, they had a number of students also, but Kingsway Academy got 5 of the awards for the poster competition. So encourage your family members to go and see what our kids have learned about glaucoma.
Thank you. Thank you so much, Ms. Swift. Anyone else? Anyone else would like to share anything or add anything? You want to share a page? Dr. Ash, Dr. Tinio, Nurse Meadows, Nurse Gordon, before we end?
We have a Facebook page, the Bahamas Society of Ophthalmic Nurses on Facebook. So you can also visit us there. So you can keep up to date with the current initiatives and anything that we are planning for futuristic events.
Thank you.
Yeah.
Thank you all. Go ahead, Dr. Tinio.
Okay, I just like to say, just visit your eye doctor so we'll be able to help you with this.
Yes,
I'd
definitely.
I would also like to say that it's very important, and do not feel afraid to come to me, come to any one of us and say, I want to learn more about this. We are here to share this. We want this to get out there, from the smallest little child who can talk to the oldest person, because it affects all of us. I personally do not want a blind Bahamas, and I know nobody here wants that. So we as a team have to continue to strive to work hard to inform persons that yes, this is preventable. Let us do it.
Thank you, Nurse Meadows. Dr. Ash, any final words?
Just being, I believe prevention is better than cure. Yes, the medications can be costly, but think about money's lost if you can't see to work to earn money.
Wow.
Okay, no matter all the money you have, but you still can't drive a car. You could have the nicest car, but you can't drive it. So it should be a top priority. You got to put the priority on your eyes, and it's so important to have that eye exam. It's so important, like Dr. Tinio said, to take the medications when they are given to you by your doctor. We're a team. This is a partnership. The doctors, the patient, the nurses, we're all on the same team. We all want to win. Winning is you having the excellent vision that God gave you. And so it's so important to keep the follow-up appointments, use the drops as you are instructed to, and let's have a Seeing Bahamas.
Thank you, Dr. Ash. Nurse Gordon, you're quiet, but you mentioned a very important point. You talked about, simple injury that led to blindness, and I think that's so important, to reiterate to persons that it can take something very simple to lose your sight. And the eyes, we kind of take it for granted, but it's very important to do those screenings. And so that's why it's so important that all of you are here to talk about glaucoma awareness. And I know it's only for a week, but we want to continue to talk about the importance of eye screening and eye tests and all of those things, because it plays a very important part in us maintaining our eye health. And so I'm so grateful for all of you taking the time out of your schedule just to be here to share this knowledge for persons really to be aware of the simple things. Dr. Ash, you mentioned that there is no sign. There's no, your eye doesn't itch. There's nothing that's gonna, kind of prompt you to say, hey, I need to get my eye tested. You could go to sleep and wake up one day and just find yourself in a situation where you don't have your vision. So it's scary. Ms. Hepburn, you have a question?
I would just like to make a comment that we have started a Bahamas Glaucoma support group. And we usually have the meetings at the clinic. So maybe when COVID has settled down, we'll start again. So people can call the eye clinic and we will give them more information, because it's a scary thing to find out that you have glaucoma. You don't have any family members that you know have glaucoma. You don't know anything. And I've seen people just break down and cry. So we have a group that encourages people on how to go about day to day and how to take their medication and what they can do, and just be there for one another.
Thank you, Ms. Hepper, for mentioning that. Thank you so much. Talking about that support group. And so I want to thank all of you for sharing this information. Nurse Gordon, I gotta talk to you. I want to thank you guys for taking the time out today for sharing this information with us. I want to welcome you back for us to continue this conversation in whichever way, not just within this week, but just for persons to have this knowledge, because it's very important. And so with that, we come to the end of our session. We'll get back to our trivia. I'll go over the comments and we'll get back to it. So I'll comment in the trivia for those persons who would have been viewing and share their answers. But as it pertains to this session, we've come to the end. I want to thank all of you for viewing, those our doctors and nurses who are here on this platform with us today. Thank you, everyone, and can we talk?